Hello, my name is Sophie Collins, and today I'll be presenting the effect of inhaled nitric oxide on exercise capacity in chronic obstructive pulmonary disease, or COPD. COPD is characterized by progressive, partially reversible airway obstruction, dyspnea, and exercise intolerance. Dyspnea in COPD patients is partly explained by an exaggerated ventilatory response to exercise, which is determined by the ventilatory equivalent for carbon dioxide production, or VEVCO2. Previous work has shown that an increased ventilatory response to exercise is prognostic of mortality in COPD. The increased VEVCO2 in mild COPD can be explained by pulmonary vascular dysfunction, resulting in ventilation perfusion abnormalities, specifically areas of normal ventilation but low relative perfusion. Our prior work has shown that inhaled nitric oxide improves ventilation and exercise capacity and reduces dyspnea by modifying pulmonary vascular function in mild COPD. However, in advanced COPD, there is progressive pulmonary vascular destruction, making it unclear whether vascular dysfunction represents a therapeutic target. Therefore, the purpose of this study is to determine the effect of inhaled nitric oxide on VEVCO2, dyspnea, and exercise capacity in patients with moderate and severe COPD. We hypothesize that inhaled nitric oxide will improve exercise capacity in moderate COPD, secondary to a reduction in VEVCO2, while no effect will be observed in severe COPD. In a randomized placebo-controlled double-blind crossover study, patients with moderate COPD were recruited. On day 1, patients completed a pulmonary function test and a symptom-limited incremental cardiopulmonary exercise test to determine peak oxygen consumption. On days 2 and 3, patients completed a cardiopulmonary exercise test, breathing room air or inhaled nitric oxide, with the order randomized. During exercise, oxygen consumption, or VO2, and VEVCO2 were recorded continuously, and dyspnea ratings were obtained every 2 minutes. In the patients tested to date, there was no change in VO2, VEVCO2, or dyspnea with inhaled nitric oxide during exercise. Initial results would suggest that inhaled nitric oxide does not improve exercise capacity, VEVCO2, or dyspnea in patients with moderate COPD, which is in contrast to our earlier work in patients with mild COPD. Our findings would suggest that patients with moderate COPD exhibit signs of vascular destruction. This study will help identify COPD patients with pulmonary vascular dysfunction that are responsive to inhaled nitric oxide and help identify the clinical phenotype which may be responsive to pulmonary vascular therapy. Thank you.